real conversations, and some hard truths. Gangs, drugs, and guns. Giving a voice to those willing to sacrifice. We have stories that need to be told. We have lessons that need to be taught. Protect and serve. Welcome to The Quiet Professional. Hey everybody, welcome back. Nathan Romas with you. Today we are going to be talking about city planning, transit systems, and what's needed to keep them safe. For that, I have David Cooper here. David is the principal and founder of Leading Mobility. They are a transportation planning firm that offers strategic and planning support for public transit, infrastructure delivery, stakeholder support, and government relations projects and initiatives. David has worked in several major cities from Toronto to Vancouver and implemented projects involving several means of transportation from subway systems and light rail transit to electric buses. So David also does some teaching on the side, universities of Toronto and Calgary. You've been recognized for several awards, one of which here, the Individual Leadership Award from the Canadian Urban Transit Association. We also had the Mass Transit's Top 40 Under 40 Award in North America. So needless to say, you're qualified to speak on the topics we're going to talk about today. So welcome, David.
Thanks, Nathan, for having me.
Maybe one thing I'll kind of point out right at the start, we had prior conversations, and I got to thinking after one of them, you're kind of like, would it be fair to describe you as a real life Sim City? Are you like, you're planning these cities, you're putting things together, you're building them? Is that a fair way to describe your job?
So, the funny thing in planning school many years ago is they went around the room and they said, why did you pick planning? It's such a specific field, in terms of city planning and the role of what planners do in terms of building cities and how people live in cities and get around them. And the answer people would say sometimes, which actually annoyed me a bit, was, oh, I played SimCity. And if you actually played SimCity and then you practice as a planner, you'll notice that they're very different. SimCity is kind of a gamification of what city planning is. And it makes it a lot simpler than it actually is. When you work with people from all walks of life and you work with, you have conversations about how you're going to create change in the community. And hopefully you're trying to make things better, from building more housing, putting in transit, working on public safety. It's very complex and messy sometimes. And sometimes I think SimCity kind of undersells that a little bit. But I think I also like in the sense that people generally know what planners do. When I started working in planning in 2005, a lot of people didn't really know what city planners were. And now there's a big conversation about the role of planning is in terms of our communities and how you work with planners and how planners work with you. But SimCity was not the reason why I went into planning, but I have played the game.
Yeah. Okay. So you have,
Yeah.
well, at least you have the reference. I was like, man, I hope he's at least knows what I'm talking about, or this is going to fall completely flat.
Oh, I've seen it. I played it. I played like the 1990s version, I think, on Super Nintendo. So it's been a while.
Going way back. Yeah. Well, you know what? You talked a little bit about how, some of your past, but how does one get into city planning, or, what's kind of a path toward that, in case anyone's wondering?
So city planning, I think, attracts a few different folks. People who really like urban design really love city planning because you get to shape the form of the city, right? You get to shape parks and public spaces and housing and all those things. There's elements of architecture in city planning that, for the same kind of reasons. There's a lot of policy work in city planning. So individuals that like to understand how policy impacts you as a citizen versus impacts kind of society as a whole. There's a lot of work in that in city planning. My interest really came into the transit space very early. I wanted to be an urban planner since I was 5. Maybe I was just a bit of an odd kid in that sense. But one of the things that was very evident to me is that I love systems thinking, because if you do something in your work, it impacts other people's ability to live in their cities. And systems thinking is huge in planning. And one of the things that planning does, it kind of touches everything. Like, people are like, oh, what do planners do? And I kind of point out the street. I'm like, look around. Like, the planner's responsible for determining how wide that street is, what types of uses are on that street, how often that bus goes by, where are we planting trees? Where's the school going to be? Where's the community center going to be? But also, we actually do a lot of things that are actually tied to emergency services. So I'll give you an example. My first summer job in planning was in Fort McMurray, Alberta, and we had this explosive growth going on at the time from a lot of oil sands development in northern Alberta. And one of the things we had to do, and a project I was working on, was doing some work on the municipal census because our population dictated how many RCMP officers we got. It dictated
Okay.
how much funding we got for hospital beds. It dictated our community services funding. It helped dictate transit service hours. So a lot of it's so interconnected, and transit I always love because maybe I'm a bit of a train nerd, but like transit systems thinking, like if you go on a bus in Edmonton versus a bus in Toronto versus, a system in Europe or the States, it's very different. Like how you get around your city is very different. But the role of transit is the same. People rely on transit to get to school, to get to work, to keep their social connections with each other,
Yeah.
there's huge employment mobility conversations on it. So it is such a key integral part of our cities. And, transit has a lot of public support, thankfully. People want to invest in transit and they want it to keep it clean, safe, and reliable. And that's something I've been very fortunate to really spend most of my career on is how do we take that systems thinking and make it work for people?
Yeah, I think so, when you see the headlines and different things that people are maybe get upset about certain topics, I think they really aren't realizing just how complex it is. Although I will say, sometimes it's interesting when you see a train line get put in and then all of a sudden all the signals don't work. Like Edmonton's had not a great track record of train building and some of the issues that have come up. But I mean, I try not to jump all over those kind of things because it's like I get it. It's complicated and there's many things that people have to think about or consider. Maybe we'll start with kind of the broad spectrum and talk about why is it such a complex topic. So what are a lot of the factors that come into building out these transit systems, whether it's train or buses? What's all involved in that?
So there's a number of things that planners will look at when you're designing a bus or a train system, and it's pretty universal, I'd say, across North America. So the first thing I would look at is where's the growth occurring in the city? What's our road network look like? Where's the population projections look like? What are the destinations that people need to go to? Who's on our system and where do they need to go? What's our ability to, do we have space to put in, let's say, rail infrastructure? Do we have the demand to put that in? What's going to change with the city? One of the most catalytic investments you can have right now in North American cities is actually the development of rapid transit. Like when you look at the before and after, let's say, of a rapid transit project, you will see almost a very different city in terms
Mhm.
of the additional amenities that come to your neighborhood, the additional housing, but also there's some issues. Like sometimes we have we in our field want to have transit oriented development where you create these complete communities around our transit stations. But sometimes we also fall in the trap of having transit oriented displacement, where sometimes a train line will come in and individuals who are reliant on transit get priced out of their areas too. So, what are
Okay.
these complexities that occur from each other? And we see this, and it's even rearing its head. Like you and I are both from Edmonton, and we see these happening in cities all across North America now. I think what's changed in the conversation on transit for folks like myself and many others is that the three core principles of running public transit is clean, safe, reliable. And one of the things that has really amplified the conversation and why I'm here today talking to you is the safety conversation. We've seen a pretty significant shift in the conversation of transit safety. We've seen some changes in terms of what we're seeing from a trend perspective on transit safety. And we've seen such a heightened public and political conversation on transit safety and where to go from here. And that's something that's very different on transit. We've always had safety has been very key on making sure that you get from point A to B safely. But we've never had a big conversation like this before the pandemic. Like we've always had, transit peace officers or support from our police
Yeah.
partners or support from outreach, but it's really amplified and multiplied in what that conversation is and what these program approaches and partnerships are through the pandemic for a number of different reasons. And I know we'll get into that.
Yeah. Well, and I think one of the big contributing factors was some of the bylaw changes and even some of the criminal changes, right? With the criminal code, when we're talking about just simple possession of drugs and in tandem with bylaw changes that say we're going to allow open air use of drugs, or we're going to have safe zones, or whatever they're called. There's just, yeah, a lot of factors kind of converging in one space in those transit spaces. And just kind of talking about, I just want to back up a little bit. We'll get onto the public safety side mostly. One question I did have though was just when you were talking about whether a neighborhood kind of gets built around some form of transit or something like more lanes for vehicles. Is there a way to like survey people or find out what the consensus is? Do people generally want more lanes for vehicles, or are they looking for more of those public transit options?
So I think there's a bit of both on that. That's a really great question. And I might not have the most uncomplex answer to it. I think, people want choice. When people take a trip, they're going to look at a number of factors. They're going to look at how long is it going to take the trip. They're going to look at, if you're driving, is there parking where you're going? They're going to look at the cost of gas and
Hmm.
mileage and things like that. They're going to look at when they look at transit, is the trip direct? Is the easy to navigate? Do I know where I'm going? Is the fare something that is reasonable to pay for? Is it going to be reliable? Right. So I think at the end of the day, people want choice. Even if you have new suburban neighborhoods, we still get lots of calls in at the transit agency to say, hey, we want service. And the reason why they want service is sometimes people, I'll give you an example from Calgary. Sometimes people, they want transit options to get to work where they are, because the Calgary is the second highest parking rates in North America past Manhattan
Yeah.
for a number of policy reasons. Two, kids got to go to school and their parents are not going to drive them. So, there's that piece. And then also there's also localized need within your neighborhoods for transit service. At the end of the day, one of the things that has been really studied a lot over time is that if you build an extra lane of traffic, travel patterns do change and that lane will fill. And it's kind of this kind of self-fulfilling, prophecy that keeps happening everywhere. And you'll see that, you add a lane of traffic and then 2 years later it's full. Well, it's because everyone modified their traffic, their travel patterns, because like, oh, there's capacity on this road. So, we will definitely modify our patterns to do that. And then you're back at the same spot, right? So transit doesn't have it as much. Obviously popular service have, crowding and busy times and sometimes a little bit of congestion, but people want choice. And that's no different with bike lanes. Bike lanes, people will use their bike if there is a facility or infrastructure to use it, but then bike lanes come with controversy because sometimes we're repurposing the street. So
Yeah.
one of the things that I think at the end of the day, people want choices. You just have to make every choice viable for them to actually take it. Right. And that to me is either if it's a car trip, a bike trip, a transit trip, people want choice of how they're going to do it. And sometimes like people have, I bike, I take transit, I own a car. Like I choose the option, I'll walk. I choose the option that makes sense for the trip I make. And that's what we hope to provide others when they get around their cities.
Yeah. You know what? Actually, that's a good way to put it is like, so you directly have experience using all modes of transport,
Yeah.
and it kind of is dictated on, where am I going and what's the purpose for going there. For me, one of the things I always thought of was freedom was one of the big things. So, people want to own their own car because they want their own freedom. I want to go where I want to go when I want to do it. And it's almost priceless, right? When it comes to freedom. So, as much as gas prices go up and people might complain about it, I think they're still going to pay it to some level. The other thing I always wondered too is, when you have, say, like a single parent, and if they have to take public transit to get to their job, well, the delay in waiting for a bus or a train, and then the time it takes you to travel somewhere, and if something doesn't go right or breaks down or whatever, it slows you down. It might not be that you can now work two jobs because maybe even like you're saying, the train doesn't get to that point. So I think there's a lot of limiting factors, when some of those arguments come up. But again, I think you said it very well. It kind of depends on your end destination and the purpose for using it. Maybe we'll jump back to the public safety aspect. This is occupy most of our time today. So when we had our previous chats, you talked a little bit about some of the experiences you've had in going on ride-alongs. I wonder if you could talk about some of the public safety aspects to transit and some of your own experiences in those spaces?
So that's a great question. I feel like I have a very long answer for you on that.
We got lots of
So
time.
I'll try to break it. Yeah, I'll try to break it up for you and components here. So I'll back up to kind of where my interest went into this. So we had the pandemic come upon us in March of 2020, and I remained staying using transit through the pandemic. And what occurred is we saw this transition in our public spaces. And this is no different than our parks or public spaces. Our libraries have a lot of the same kind of considerations right now. Is we've seen a number of different complexities occurring in our public spaces. So transit's always been a safe space. We pride ourselves on being a safe space in terms of a place and infrastructure. And when it occurred is we lost 80% of our ridership. Canadian agencies lost 80% of almost immediately. And we went into this revenue and just service crisis. And, fortunately, we did get some emergency funding for a while from our provincial and federal government to maintain service levels. And we're now, I'd say, probably about 80 to 90% back in our ridership, which is a significant, really good news story. The ridership composition is a bit different, like our travel patterns are a bit different. But one of the things that occurred on our systems is we were one of the few public spaces that remained open. And what ended up happening is we lost so much of our ridership, and then we had these compounding social complexities that started to really rearing its head. We've had more complexities when it comes to mental health. We've had more complexities when it comes to access to housing and supports. We've had more complexities when it comes to substance use. And I'm of the opinion that we are not having more, like, transit safety is not driven by individuals who are unhoused. It's not driven by individuals who are using substances, but there's a lot of carry on issues that are kind of in the orbit of a lot of things that are going on in transit safety that have reared their head, also aligned with and in the realm of some of these complexities. And one of the things that I started noticing is I do a lot of work with the big transit agencies here in Canada. And I went up to a couple of them and I said, I've been noticing a lot more disruptions on service when it comes to confrontations that are happening on board vehicles. I'm noticing things where there are more uncomfortable situations for customers and sometimes myself, and obviously a bigger conversation on the role of public safety on transit. And I was teaching a class at Toronto Metropolitan University at the time, and I said, you know what, I'm going to start doing some research on what is actually happening from a trend perspective. Like, are our offenses against customers going up? Are offenses against staff going up? Are property incidents going up? And as I started doing this, a lot of the agencies started contacting me and said, hey, we actually have a problem. Can you help us? And what ended up happening was I got to work with 7 of the largest agencies in development of the national transit safety recommendations and also this research project, and then also helping out with some of the public transit safety strategies for a couple of big systems. And what was very interesting from the role of the planner, and I didn't think I was going to go into the realm of this, but what was interesting from the conversation, like, I'm not a public safety expert. But the role of the planner is we work with everyone. We work with people from architecture, design, engineering, human services, public policy, politicians, the media. And
Yeah.
one of the things that we're trained to do is we're trained to take the data, we're trained to talk to people, we're trained to build consensus, we're trained to come up with options, alternatives, and some recommendations of the path forward. And I said to one of my colleagues at the Toronto Transit Commission over a coffee chat a couple of years ago, before I decided to create this master's course on transit safety and start doing this research work, which really ballooned into something much bigger than myself, which I didn't realize was going to happen, was I said, I have 2 options. I have an option of either complaining to the agencies to do something, or I have an option of doing something.
Mhm.
And I think my value in the conversation is to help the dialogue of what is actually going on. And what was interesting from my perspective as also an independent consultant, but also someone who teaches, is like, I'm a third party. Like, I'm not married to the program designs that are in there. I'm not married to, who's doing what, when, and how from like a
Yeah.
roles responsibilities perspective. I'm married to like the outcomes. Like, are we actually achieving the outcomes of building a safer transit system? And that's where my interest came in. And some of the things that was very eye opening that I've never had in my career, and I'm working in planning for 19 years now, is there was this level of desperation, I think, from the transit agencies, but also our frontline outreach partners and also our frontline peace officers and also the police on like, there's so much happening at us at once. Where do we go? And I will never forget, and this happened several times. I was able to go out with an outreach team in Calgary, got to see some of their program pieces. They do a lot of housing referrals and social support and amazing work.
Hmm.
And definitely helped on a project to get their team expanded and saw some of the limitations, but also some of the wins they're getting from their program, which was huge. But I also got to go out with the police in three major cities in Vancouver, Calgary, and Montreal through some of this work through the National Transit Recommendations and this research study. And what was interesting, and I've never had this happen before to me in my 19 years of working, is you work with so many stakeholders. I would be in the police station, and people that also worked as part of their social service teams and others would hear I'm in the building,
Mm.
and they would search me out in the building and then start telling me stories immediately of like the complexities that they're seeing on the system, on the transit system, the complexities that they're seeing in their ability to help people, the complexity that they're seeing from the limitations of what they can do, and also the politics of the whole thing. And I've
Police
never,
have never had an issue telling people what's what.
yeah, yeah. That is true. But it was done in a way that I thought was very eye opening in the sense that people were very empathetic and compassionate in their storytelling. They were
Yeah.
very, they wanted to show like they're like, come out and we'll show you exactly what's going on. And I was like, what, I'm a person who like I write reports that politicians debate and make decisions on. I write reports for the public to analyze and speak about. And you know what, frankly, like I think I can pull all the data in the world if but you get such an interesting, unique perspective when you actually talk to the people from the front line, from the outreach workers to city partner organizations to the police, and you get a lot of the stories do check out with the data, but also you get such a different perspective of actually hearing like this is some of the limitations of the programs or the regulations or the laws or whatever we have on what's going on.
So is that something that as a planner, when you're coming up and you're drawing out the whole map of everything and how it should be laid out, and you're doing all these consultations, but to actually see it. So when you go out there and you see how the system's actually being used by all the different types of users of it, was there stuff that was really surprising to you or anything that you're like, wow, I never thought about this, or I didn't expect this to be this bad or this good. Like, so, what were kind of the surprises out of that whole experience?
So I'll keep it to the conversations and the experience of going out with the police on this, because I think that's kind of more the focus
Yeah,
of your
sure.
show. Is there's I think a few things that I've really taken back that really surprised me, and there's a few things that also validated what the data was saying and things that we could see that were issues. I think the things that surprised me from like a personal level is I was out in Calgary, and they were. I spent a shift, a 12-hour shift, with a frontline officer on the LRT system. And what was quite interesting is one of the things. It was a cold night in the winter, and there's a lot of complexities when it comes to seasonality and sometimes calls for service or things that people are maybe concerned about on the transit system. And we would walk into some of the stations, and there's sometimes people that are sheltering in place in the stations because either they have nowhere to go, or they're staying within a particular friend group, or they feel safer in the station, versus other public spaces and things like that. And when the officer came in, the officer knew the name of all the people in the station,
Yeah.
and they all knew the officer's first name. And it was very conversational. And what was very interesting to see is people would then turn to me and they said why I was there immediately. And people would just tell me their stories. And some of these stories are very sad. And some of the stories were things like, sometimes people were going into different programs, but they couldn't stay in the program because of an external, a situation or issue, or they couldn't stay in a program because they were with a partner, or they had a dog, or they couldn't like leave their things, or there's other types of limitations. And like, these are things you don't read in a report. These are things you have to hear from people. And the thing that was just eye opening to me, and I saw this kind of recurring, throughout the night. And I went out on, I think, 6 night shifts last year with several of these policing agencies and also with some of the outreach workers. And I'll be doing this actually in the States coming up for a US project coming up, is everyone knows each other.
Yeah.
That was one of my biggest surprise. They only know each other by their names. They know the stories. They know the officer's name. They know the officer's stories. And it wasn't adversarial. Like, it was very, very, very conversational. It was just like, oh, hey, how's your Tuesday? Like, what's going on? Like, are you okay? Like, and just there was this continuity of a narrative that was very different that I had not seen.
Yeah. Contrary to what I'd say a lot of the headlines might have you think is going on between
Yeah.
police and homeless people, or somebody that has mental health or drug abuse issues. Like, so whatever's going on down in the train areas or even on the transit buses, we have the same issues on the transit buses. I don't think the narrative doesn't match the reality in a lot of respects.
And I saw the same thing in Montreal. I went out with Montreal and saw exactly the same thing. A lot of them know, and in fairness, like, there are tension points between some people and the police. I'm not going to undersell that, and I think that's with the individual people and the police with those individual people.
Certainly.
But yeah, and like, I can't, and there could be a number of reasons. One, they don't like the police, or two, they've had bad run-ins, or the run-ins, police have had run-ins with them, or systemic issues of significance up to the person. But what was interesting to me is we had people from all walks of life, and they all knew each other.
Yeah.
Like, there was no that, and they weren't conducting enforcement action. Like, and that's some of the limitations. Like, there's limitations in enforcement action because the enforcement action a lot of the times actually don't get you a better outcome. At the end of the day, because at the end of the day, when people need support, it's a wraparound type support when it comes to harm reduction or recovery or access to housing and things like that. And that's not an enforcement thing. We had a very interesting conversation. I met with 12 members of a squad in Montreal that were assigned to the Metro. And we had a 2-hour conversation. It was very wide ranging. Before I went out with them, they invited me to come back. So I came back a month later. And so they were quite insistent. And I was like, you know what, fine, let's go see. And, and one of the things that, their conversation was like, certain things are policing matters and certain things are matters that are not policing. And then there's that tension, right? And they're not this, and, they were very clear, we're not the solution to everything that's going on here. Like, we're one part of the equation.
Mm-hmm.
And I think that's where the complexity of the role of policing comes in, is that if there's a criminal offense, that's a policing matter on transit, right? So I'll give you an example. Like, if there's an offense with a knife or a weapon, like, that's a policing matter. If there's an offense with that requires intervention because of the Criminal Code of Canada, that's a policing matter. And those are usually things such as pretty significant substance use issues or violent issues or things like that. And there's things that are for other folks to work on the continuity care model, right? So
Yeah.
but what was interesting to see is that it was a pretty similar story on the 3 cities, is that, people generally knew each other. The police were very upfront about, like, we're not the solution to everything here. Like, we're one part of the broader equation of what needs to happen. And at the end of the day, everybody wants this to be, like, solved. Like, I go to these
Yeah.
meetings within transit agencies with people that are in different departments. And the first thing I've heard about the last 2, 3 years is safety. And this is something that we need to get people back on our systems from a ridership perspective, from a city livability perspective, from, like, getting people to jobs and schools. And we need to do that by providing, we can provide a clean and reliable service. We need help on the safety part. We're transportation providers. We're not, we need the expertise from our safety partners, and that includes outreach and police. But we can't have a scenario where people don't come back because they don't feel safe. And that's a big problem for transit agencies. And it's not just from the actual numbers of the incidents, and we've had incidents, but it's also the perception. If people don't perceive things are safe, they're not going to come, right? They're not going to use the system, right? So
When we're talking about, like, the number of people that are actually using the service, do you see in the data, do you see more or less incidents or occurrences where police or peace officers need to intervene when there's less ridership or more ridership? Like, does having a number of civilians there decrease criminal activity? Maybe it's just more eyes there, or I just kind of think of the job I do. The less people that are out when I'm walking through venues and looking for gangsters, it's easier when there's less people because I can just see them, right? When there's a
Yeah.
giant crowd, the criminal element just hides in and amongst them. So I'm wondering too, do incidents go up or down based on how many civilians are on the transit system? Or is it just that we're maybe not seeing it?
So I think there's a little bit of context piece, and Nathan, I appreciate kind of where you're coming from from a policing perspective. For us, like, the more people on the transit system, the less opportunity is for crime. There's less opportunity for issues of safety, and
Yeah.
and part of it is that crime is really an opportunity based situation. If you're going to commit a bad act against someone, you're not going to do it in front of a big crowd of people that are one going to hopefully help the person, call for help, or be a deterrent by just physically by being there, right? So for us, one of the safer things is actually like getting people back in the system. One of the
Hmm.
things we've heard from both, our customers, but also our staff, is the number one thing that people want to see is staff visibility. Now, staff visibility could be in many different ways. It could be from additional frontline transit staff, could be from additional transit peace officers and special constables, depending where you are in the country. It could be additional policing, depending on the context and the situation. But the feeling that we've had is, and what we've heard pretty loud and clear from both customers and staff, is we want people. And the more people you have, the less likely you're going to have situations. When we look at the data from across Canada, there was an uptick in offenses against persons. There was an uptick in offenses against property. There was an uptick against offenses against our staff.
Okay.
And during the pandemic, and it started to trend down now. And what we've noticed, and when we talk about the numbers of offenses, I'll give you an example. So in Toronto last year, there was a number of very high profile, very sad incidents that occurred on the transit system. And the transit system carries over, I think, over 1 million people a day, and we're having about 5 incidents a day,
Yeah.
like, which is still too high in our opinion. And these are high impact incidents. These are incidents that are going to change people's lives. Like, I do not want to undersell that. I think we're trending downwards nationally, but what we've also seen the last year is that we've had a much bigger conversation with our political decision makers about making sure systems are safe. We have a much bigger conversation with our customers and the public about the importance of making transit a safe and also a successful service for people who want to come back to. We've also had a lot more people on the system. We've had a ridership come back, but we also have a lot more resources than we've ever had before. So, we've had an increase in our frontline staff that are helping out through, reserve and report from, let's say, ambassadors or additional frontline operational staff. We've had hiring of additional peace officers. We've had in several cities, mental health clinicians and outreach workers and partnership models through third parties supporting, providing people support on our transit systems. We've had dedicated police resources for the first time in some of our transit systems. So I think, the purpose of having more people in the system, it's helpful and what people want. But also, I think what people need to realize in the conversation that's been happening more lately is that, we're seeing a downward trend on on our incidents and our metrics, but you can't just wash your hands and say it's done, right?
Yeah.
Like, the sustainment is a huge conversation that needs to happen. And right now, like, we don't have the mental health supports as we need on our transit systems right now. We've had several situations I could think of off the top of my head where someone's having some mental health complexities that it incurs into an unsafe situation and a service disruption. We don't have the skill set to deal with that. Overall, we have to rely on our partners to do that. When we go to our partner agencies and say, "Hey, like, we need some support," everyone says, "Yes, we want to help you," but they're also being pulled amongst other things that are occurring in our communities too, right? So, and if you were to have a job in the space of social services and outreach, that takes years of experience, that takes training, that
Yeah.
takes time, that takes a person who wants to do that work. It's very emotional. I've been in so many conversations, meetings on this topic where sometimes I leave meetings very upset because I see a systematic challenge that we're not meeting on one thing, or we're seeing a gap on another thing, or we're seeing a really tragic situation on another thing. And like, how do you marry this all together into finding some solutions? It's hard. And you probably have that too in your work, right? Like you will
Yeah.
see things that do bother you from time to time. And I have that too on this.
Well, and talking about some of the risk aspects, you brought it up kind of in the middle of your what you were saying, and one of the things I kind of think of is like, we can have that vision zero goal,
Mhm.
but the reality of it is when you put people around other people, there's bound to be conflict in some way for like, it could be a million different reasons. But when we put all the people on the trains and the buses and have them in those spaces like the stations, there's bound to be some conflict. And I think, if you're saying you have like a million riders a day and you have five conflicts, it's a very low percentage. So, I could walk out of my house and I make the choice to drive my car. There's a chance I hit something or someone hits me. I could just walk down the sidewalk. There's still a chance that somebody jumps a curb and hits me, or, something happens. It's accepting those risks. It's like it's such a low probability. It's the same thing I say about police use of force. People get all up in arms about police use of force, and it's like 0.00 of a percent of occurrences turn into a use of force. Like, let's talk about the real numbers, right? And use the real probability when we're assessing these things. I think you had a lot of good points in there. The other thing I want to mention too is talking about, like, you have people in those areas that have mental health or are using drugs. But in your report from the Canadian Urban Transit Association, in there you have a good point on how you have these small things going on, but those bring in the outside issues. So now you bring in, oh, okay, we have drug users in this area. Now the drug traffickers show up in this area, and it invites more and more issues when you let the small things go. So when we talk about who's responsible for the safety in these places, can you kind of give us an idea of, I guess, first of all, who's responsible for transit? Like at what level of government? And then in the space itself, who's responsible for the safety in there?
That's a really good question and very complex, and I'll walk you through some thoughts on that. So one of the more challenging conversations right now is on substance use on transit, and myself and a couple of colleagues, researchers, are actually going to 5 U.S. cities in the states. We got a research grant to do the first national study on the impact of substance use on transit. So we're visiting 5 large U.S. systems, and they all have differing components on outreach, enforcement, like legislative frameworks, psychological approaches, in some ways on this. I think the challenge that's occurred with substance use on transit, and we've had the same issues. We have an opioid crisis in our public spaces. This has not been
Yeah.
immune on transit. I've seen it myself. You walk down the streets, you see it yourself, and it's really tragic what is going on that. And one of the challenges that we've had on transit is that sometimes people will go to transit spaces for the purposes of substance use because it's a safe space. If you are using a particular substance on transit, you know that you can press a help phone and get help. You know that there's people there that will observe you and can intervene to get help. People have communicated that benefit of transit to each other in those kind of situations. But the issue then comes to on the transit agency is that their mandate, they're a city and regional service predominantly, and their mandate is to move people from A to B. We do not have the infrastructure in place to accommodate that, and that's really a provincial government and sometimes a federal government responsibility. And one of the challenges that we are having on some of our transit systems today is that because we don't have a supervised consumption site, or we don't have some of those harm reduction public health components, people come to the station. And they come to the station because it's in a centralized location, it's well lit, it's a place that people convene, it's a place that you can get help if needed. And but then the problem is when you have customers that are coming back on the system and they see, all these other things occurring from a societal complexity when it comes to substance use, you get this tension point where you have your safe space that people want to come to because they feel safe, but then you also have customers coming and they're like, what is going on right now? So
On that is like, who wants to be the first one through the door? Like, okay, we're going to bring people back, but
yeah,
you be the first one to go in there and hang out. So it could be a challenge.
no, and it's a challenge, and one of the things that has been really a tension point, and is the provincial governments are the ones who provide healthcare in the country, obviously also funded by the feds. And if we don't have those, upstream programs, people need somewhere to go, and they're coming to transit because they have nowhere to go. And that is no different than individuals sometimes who are sheltering in place because during cold weather nights. Because I'll give you an example in Toronto, we don't have shelter space. There's 85,000 people on a wait
Wow.
list right now for social housing in Toronto. The Toronto Transit Commission provided shelter buses for individuals that were sheltering in place on the system. It's not a solution, but they did it so that people are not sleeping on the streets. And so we're having agencies do things that are completely out of their realm because they're trying to be a good public, service and partner. But at the same time, there's limitations to that when it's not their responsibility. I think we've seen a heightened conversation from within transit agencies on what their role could be in finding some solutions on this, and what is, in their lane and what's not in their lane, or what has to be in their lane. That those conversations have changed quite positively, in my opinion, on finding these partnerships. But this is where the provinces really have to come in. Like they're the ones that provide these type of services, all day warming centers, all
Yeah.
day cooling centers in the hot months, like people have very passionate opinions about harm reduction and supervised consumption sites. Some people think that it's, that's needed. Some people don't want them in their neighborhoods. It's another complexity in this whole thing, right? I'm of the mindset, from what I've seen and what I've worked on, is that we can't be that space because we are not that space. Like we're not designed to be that space. We should
Yeah,
not
I
be
would
in that
agree.
space. But unfortunately, fortunately and fortunately, people are coming to our spaces because they are safe in a lot of ways, right? So we're in this weird catch-22 on this one, and we're not in a good position until we get some additional support from it's really the provincial governments, and some of them have stepped up in terms of additional funding, but we need the expertise and we need the offsite infrastructure, and that's been a missing part of this on this, and I think quite nationally.
Is it better when the government just hands the money over and just gives it to whatever agencies it might be, like private ones? Or is it better if the government kind of runs the whole show or most of it when you see, like, when you're looking for certain outcomes? And I guess, like, you've worked in several different cities, big cities, so you might have some opinion on this.
That's a hard one. It really depends, I think, on the service that you're looking to
Okay.
provide from a third party partnership. I think you do need third party partners for a lot of different things. But then it gets really complex when it comes to roles and responsibilities, right? Because at the end of the day, you're relying on another agency to provide a core service that you can't do yourself because you either don't have the expertise or the people power to do it, right? So I think it's very specific. I think on some of the healthcare pieces, like, sometimes you may have a third party provide that service, but at the end of the day, it's the province's responsibility, and
Yeah.
and we need the province more at the table on these conversations. And it can't just be money; it has to be also some of these upstream and supports. The other part too is, and I've had conversations with like the federal government on this too, and there's, they've said like, what's our role in this? And the role, frankly, in my mind, is like, if you give people housing or access to housing, then our ability to have those wraparound services to support people, and the ability to provide, some form of continuity of care, is a lot easier than when we don't have that access to housing. We have some cities have shelter space, some cities don't, right? And if we don't have the ability to have a centralized way to provide help to somebody, I think that's something there, right? So, but some people, the thing is, like, I'm only speaking from the perspective of, like, my environment is the transit system. Like, we are a place of public space. I'm not an expert on what happens upstream and downstream. I'm just kind of speaking from like, okay, here's what
Yeah.
we're observing and where I think we need to go, right?
Okay. Well, maybe we'll kind of, as we're coming up to the end of the time, I want to make sure we at least get onto this topic. Try not to end on all doom and gloom. And what are you seeing out there from other cities that they're doing good? So, does anybody have it right? Has anybody started to implement some changes, especially since we're past COVID and things are kind of coming back online and getting back to some normalcy? What does it look like out there for some of the solutions?
A couple of solutions that I think are working, and there's some metrics that are they're showing some promise right now. Is Edmonton and Calgary have community outreach transit teams. They are partnership models. You have a transit peace officer with someone who has a background in outreach as their partner from a partner agency. One of the things is, they do a lot of the referrals, but they do the continuity case management a lot of the times, and they do help people to get off the street, and they do help people to get into different social service programs, into housing, into potentially some recovery supports, depending on the individual person. They help people get IDs so you can get access to things. And we've seen an increased number of people that are not coming back to the system, sheltering in place. We're seeing people that are staying within a pathway to a betterment of their life, which, and I think one of the things that people need to realize is a lot of the folks that they're interacting with, there are people who are near the end,
Yeah.
right? Like a number of individual circumstances, environmental circumstances have occurred, and there's people that are helping them to get out of it. I remember I guest lectured. I'll never forget this. I got like one of the things I'm very proud of in my work is that we created a bit of a case in Calgary to double the size of that team and last year to go to a 24/7 model, and there were 77 people that got off the street through the help of that program 2 years ago with 8 staff, and now it's going to 16. And I was telling a story about
Mm.
this, and I actually started crying in during this guest lecture on this, because I said, I never thought it is my role as a planner to ever get to have these conversations, be part of something. And council did approve the additional staff and support for that team. And I said, there's more people that will be helped from this program. And I think this program saves their lives. And being part of that, just even on the periphery of that, is huge.
You never know where your vocation and certain conversations you get to have,
Yeah.
where that'll have an impact. Just kind of walking through some doors, even just doing the podcast. I've had lots of opportunities that
Mhm.
like I would either have no business being in this space in any other means of getting here, but some of the opportunities that come your way. So yeah, that's a really good one.
And I think maybe one to end on, because this is more of a policing conversation, is I've noticed a real conversation shift between the police and some of the other partners in a very positive way. I've seen a lot of very positive conversations about, hey, we're going to help you. Like we have, you're short staff. We're going to help you, like, check things are okay. We're going to see how are you doing as, as a person. And I'm seeing that kind of conduct and that
Yeah.
kind of conversation on a very regular basis between the police services across the country and their transit agencies. Like there's a lot of communication going on right now between them to see how they can help, but also like, and they know like their part is on more of the addressing the criminality pieces, addressing some of the visibility pieces, and also there's a tension point. Some people want police, some people don't, for a multitude of reasons. So but seeing the police services have that conversation with with their city departments, their transit systems, and being very collaborative and very thoughtful from
Yeah.
the frontline officers talking like that to their partners, being the peace officers or transit frontline staff and things like that. I've seen a really big shift on that in the last 2 years, which I think has actually been quite positive.
Are you seeing a consistent message between or hearing, I guess, between the front lines and then upper management? So when any interactions you have with chiefs of police or deputy chiefs, is it kind of a consistent theme? Like they're saying, hey, we want to be in these spaces, we want to be doing these certain things, and uh, we're having a positive effect? Is there consistent messaging from the top and bottom?
What's been really interesting as a person who teaches, but also as an independent consultant, I've had the opportunity to have those conversations with very senior staff at the executive management level of police services now. I've had that conversation with politicians and senior staff at transit agencies, and then also the frontline staff, both from the transit outreach and police. I'm watching the same story. Like people are saying the same thing. I've noticed like I haven't seen a lot of variation from it. I
Okay.
think, sometimes you'll get a bit of a different perspective from, an officer who does a 10 to 12-hour shift at night versus someone who's in more of the executive role, but the message has been relatively the same. I haven't seen that much difference. Like, to be honest, I think on this file, like, yeah,
I always kind of worry, the front line sees they're out there for 10 to 12 hours. They see something
yeah,
and they hear things in a certain capacity, a different aspect to it. And then by the time the message gets all the way to the top, whoever's talking to the city council or the planners and so on and so forth, sometimes the message gets distorted or people might change it for certain reasons, but that's for different topics. But I just wondered, like, is it a consistent message? Because I know for especially for the front line, the ones who don't generally get to voice their opinions at these big meetings, it's nice to know that at least that's getting across. And my biggest thing too is always seeing is believing. I've had city councilors come on right along, people in provincial politics and chief of police. Like the biggest thing I think we can do is get people out and let them experience it and see for themselves because most of us aren't that great with words. I'm not going to ever convey with words, what someone might get to experience themselves. So, yeah, I think the work that you're doing is definitely a difficult job, very fascinating, but it's needed, right? Like we need people that are on top of these things and kind of the big brain ideas to have these conversations because there's a lot of problems to solve. And it's good to see that there are some solutions out there and we're kind of working in a direction that sounds like a positive direction.
yeah. And I think we need a multidisciplinary approach. Like going back to something I said earlier. Like, I could look at all the data, but if I actually don't talk to people that are working the jobs, I don't have a fulsome understanding of what's going on. Because at the end of the day, I got to go up in a public forum, be at a council meeting, a media interview, high level meeting, and if I can't back up what I'm going to say,
Yeah.
I think those stories from the front line do have significant weight, and I've used them from that. And I think also people appreciate, when a policy decision is made, like they need to understand how is it impacting their staff and also their partner groups, right? And also the thing I love about planning is like, I don't know, like the reason why I met you was actually through a city councilor who
Yeah.
said you should go on Nathan's show, right?
Yeah.
So and that's how I discovered, this conversation. You and I've had a long conversation about, all these complexities. And at the end of the day, like I'm not the one who's going to solve everything, but I'm the one. I have a skill set that I could help. And if I can help, create a more of a dialogue that's constructive on this, that gets people on side for a path to go forward and integrates all these different voices, and I can assess, is that something that's happening or is this something we need to dig into? Like, I have the skill set to do that, I feel. But at the end of the day, I have to talk to everyone. It's a public service and it's
Yeah.
something we need to deal with together. And it's exciting. You get to hear all these different perspectives, and sometimes they challenge you, and sometimes you're like, okay, that makes sense.
Very cool. Well, the thing we always end on is how can people find you, find your work, and follow you? So, where's the social media and websites?
Sure. So my website's leadingmobility.com. Social media, you can find me on LinkedIn. Just find David Cooper, Leading Mobility. That should pop up. And then, yeah, happy to have people reach out. There's a contact form on the website at leadingmobility.com, and always happy to learn and discuss things with people.
Awesome. I'll put up links in the episode description so that people can find you. And I'll remind everybody like, share, follow. We're trying to get the message out, trying to come up with some good ideas and solutions. So make sure you do all those things. And thank you for coming on the show today and hang on the line for 2 seconds.
Thanks for having me, Nathan.